Intro, and welcome to all who have entered the chat room. This is my first Zoom presentation, so hopefully it goes well. A little bit of background about me. My name is Connie Shelby, and I'm a state registered Medicare counselor through HICAP. I have been with HICAP almost 4 years, started out as a volunteer, took the course with them, which is 8 weeks, tested out, and then fingerprinted and became a state registered counselor and volunteered for about almost 2 years, doing one-on-one counseling through the various senior centers in the community, and working closely with Kathy Lewis at Eisenhower. And then I was offered a part-time position. I am fully retired, to do more outreach, teaching, presentations, which I've done many of at the Annenberg. And I did that for about a year until March of this year, when unfortunately we've all had to deal with COVID, and there was a major step back with doing one-on-one presentations, counseling, classes, health fairs, things like that. So I've been kind of on a hiatus, and recently made the decision not to go back as an employee, but to just step back into a volunteer role, especially during open enrollment, which there's always a need right now for the next several weeks. And open enrollment runs from December 15th through, October 15th through December 7th. Okay, so my personal background is I have 30 years experience in medical reimbursement. I'm a certified procedural coder that's in medical necessity and ICD, CPT and ICD-10. And all of my background led me to mix with very well with learning more about Medicare and teaching all the parts of Medicare, because I worked on the other end of it for all those years in managing billing offices and medical practices in San Diego County. So I'm going to just go to the first slide here. Okay, so this little cartoon, basically, most people can relate to it, because all I ever hear from anyone is, why is Medicare so complicated? And I wish I had a simple answer, but like this picture, it's not simple. It's a government program, and it's become far more complex over the last 10 years, I'm going to say, and mostly in the last 5 years with Medicare Advantages plans coming on the scene, so that you really do need guidance if you're not familiar with the system, especially if you've worked for a large employer group and never had to think about your insurance. So what is Medicare? Age 65 or older, under 65 if you're on disability for 2 years, end-stage renal disease, Lou Gehrig's disease, all qualify you to take on Medicare, and you have to be a citizen also with a resident visa for 5 years. How do you enroll? Generally through Social Security Administration. If you're a retired railroad person, you would go with the railroad board, but that's pretty rare. In the past, I've told folks that they could just go to the Social Security office. Well, they're still closed, I believe. So the best way to handle it is try to figure out what you can on SSA.gov or Medicare.gov, or try to schedule a telephone appointment with someone at HICAP. And I'll be giving out that number as well as Kathy's number during and after the presentation. So here are the 4 parts of Medicare: A, B, C, and D. It really is that straightforward, but the devil is in all of the rest of these little drop-down boxes, because that's where all the details lie, and all the lingo gets thrown around between C and D and B. So A and B is your hospital coverage, and B is your physician coverage, outpatient versus inpatient. Everyone qualifies for A pretty much, and B you sign up for and you pay a premium. And then Part C came along for what I call the HMO plans or Advantage, and Part D is the prescription drug coverage. This chart breaks it down even further, and I use this quite a bit as a visual when I'm counseling people, especially when I was doing one-on-one counseling. And we focus a lot on this chart because this is where it really breaks it down. So the original Medicare, when you see in the chart, is the way Medicare was set out to be back in the 60s when it was enacted. It allows you to see any doctor you want to see. You sign up for A and B, You enroll in a prescription drug plan, you get Part D, you buy a prescription drug coverage plan, and then you buy a Medigap or a supplemental plan, and you're pretty much covered all the way across the board. So I like to call this the more coverage side, but more cost side. You have more choice here, but it's a little more costly. The other side is the Advantage Plan Part C that came along in the late 80s and 90s. Less costs, less choice. And it rolls up everything as kind of a one-stop shop, kind of a package deal. But it still costs money. Both sides you have to pay a Part B premium for. What does it cover? Co-pays and deductibles for hospitalization and physician services. You have to have both A and B. There are 10 standardized Medigap or supplemental plans you can choose from. This is the original Medicare again. You get to choose any doctor you want in any state in the US. 6 months to buy a Medigap plan with guaranteed issuance. That means when you're brand new to Medicare, or if you've been an employee under a large employer umbrella, when you first enroll in Part B and pick a supplemental plan, you are guaranteed to be issued that policy without any pre-existing or questions put to you by the insurance company, which is great because you can get the plan and not have to go through 20 different questions. So they basically can't turn you down. What are the exclusions? Foreign travel for most plans. Some of the Advantage plans might give you limited foreign travel coverage, but those again are in the details of the plans itself. Vision and dental and hearing. Now, if there's a medical necessity for any one of these things, vision, dental, or hearing, Medicare will cover it. The one thing to remember about Medicare, if it's medically necessary and there are codes for it, they will pay for it. It's when it falls out of that, for instance, cosmetic, it's not going to be covered. Like vision would be cataract, so that's covered, but eyeglasses are not. And the same thing with foot care. If you have a medical necessity for foot surgery, it's covered. Generic things are not. Long-term care and custodial care. And I make this point every time I do the presentation. There is no one out there, original Medicare as well as the Advantage plans, that will provide you with long-term care. You get up to 90 days in a skilled nursing facility, and then you have a decision to make, or your family does, about whether you have home care or whether you're going into a assisted living facility. So that's a separate discussion with separate coverage, and long-term care is generally best bought when you're in your 50s rather than when you're in your 80s, if you can even get it at that point. Okay, here are the premiums. And I don't have 2021 premiums yet, but from what I've been reading, there's supposed to be a cost of living increase for Social Security, which means if there's any Part B increase, which they're not predicting to be very large, we had a very large one last year of about $10 over the previous year, it should cover that. So right now, that's the Part B premium. Part A, there's no monthly premium because you've paid into it all your working life. There are a few people who have not, and they have to buy it, and it could cost up to $500 a month. But the general population gets Part A without any monthly premium. Part B, you pay monthly, usually is out of your Social Security annuity benefit if you take it. If not, if you're still working as an independent and you enroll in Part B, you have to pay for it quarterly, but you have to pay the $144 and change, and whatever it is going forward, because it's decided by Congress. Part D is the drug enrollment. There's a cost for that, separate from a drug insurance plan. That's $35. I don't anticipate that going up, but we'll know probably by the end of December. And then the supplemental plans, the costs vary by each plan. Advantage, I just mentioned, it rolls everything up into one package deal for you, but there are a lot of extra costs, and it's by the plan, like co-pays, and they may subject you to a deductible, or you have to get pre-authorization for certain tests. So there's a lot of underlying details that this presentation isn't meant to cover, but I just want you to be aware of that. What are the enrollment periods? When you're brand new to Medicare, you have a 7-month window, 3 months prior to your 65th birthday, the month of your 65th birthday, and 3 months after. They're 7 months. I've always encouraged people, and will continue to do so, to do it the first 3 months up to the date of their month of their birthday. If you do it the 3 months later, that's still okay, but it's retro. You always want to be proactive with Medicare and the government. So if you know you're going to turn 65 on December 1st, you're in that enrollment period now. So go down, well, you can't really now, but you can go on Medicare.gov or SSA.gov and enroll. And it would be effective the first day of the month of your birthday. If you miss that window, you have a general enrollment period, which is the following January, the month or the year after you turn 65. So if I'm going to be 65 in December and I miss the window, I can enroll the following January of 2021. However, you will not be covered until July of 2021. It's not a good place to be because you will not have any coverage, and you'll have to scramble to get coverage from some other source. So why let that happen unless you forget? And there's no reason to do that. So yes, you have January through March, but as I said, you won't be covered. The special enrollment period applies to people who are currently employed, like Brett, who introduced me. If he continues to work for Eisenhower well past his 65th birthday, he's okay. And if he's 69 or 70 and he's retiring, he's in the special enrollment period where he goes down and lets a government know, either at Social Security or on Medicare.gov, that he's been employed, he's in a large employer plan, and now he's retiring. Original Medicare, as I said, is Part A, hospital insurance. There's a 0 monthly premium. Again, you don't pay for that because you've paid into it for your working life. Is there a deductible? Yes, every time you go into the hospital. Now, this slide says per spell. I didn't write these slides. That's kind of an old-fashioned word, but it simply means every time you're admitted, and if you're admitted 3 times in a year, that deductible will apply. So the $1,408 is a deductible amount, and what do people do with that? If they don't have supplemental, they have to pay for it. If they have supplemental, it's covered. Then there's no copay if you're in the hospital for 1 to 60 days. Part B, the $144 is a monthly amount you have to pay every month. It comes again out of Social Security or you're billed quarterly. There is an annual deductible. That's when you first start the year, you go to your doctor, you get a flu shot, you have an office visit. The $198 applies and you pay out of the pocket unless you buy a supplemental that covers it. And then there's a 20% coinsurance. The doctor's visit is $100. Medicare pays or allows $80. They're going to pay 80% of the $80. You, the beneficiary, come up with a difference, out of pocket or through supplemental. Now, I know this is a lot of information. I kind of know it like in my sleep, but if there's questions, we can always go back over it when there's enough time to do so. Or you can always schedule an appointment to do a one-on-one. Original Medicare, as says, the Part D has the Part D prescription drug plan. That's what you enroll in for the $35. You buy a prescription drug insurance plan. The Advantage plans or HMO plans roll that in, but you are limited to what your choices are through those plans. In the Coachella Valley, there are 48 different plans that are offered through various different corporations. So it can get overwhelming when you start talking about Advantage. That's why the personal meetings are very helpful. 32 plans in Southern California. That's pertaining to the drug plans. Optional, but penalties apply if you enroll late in Part D. So both Part D and Part B have late enrollment penalties. How is the premium applied or calculated? So there's something called a Medicare income related monthly adjusted amount. That's called IRMA. So when you first enroll in Medicare, these are the charts. If you've made less than 87,000 as an individual or 174 as a couple, you're going to pay 144.60. But those folks that are in a higher income bracket, every year Medicare will look at your income for the previous 2 years, and this chart shows you how they adjust upwards the premium. So the second bracket, we'll just talk about that briefly. You can see that if I was brand new to Medicare and I fell into that second bracket, or if my income changed and I was on Medicare for 4 years and I went up in my income because I'm still employed as a consultant or some other position, I'm going to pay $12 more. So that's my premium, $202, and it goes all the way up. So understand that every year you get a letter in around November from Medicare because they've looked at your tax return for the previous 2 years. And I think that goes on continuously. But the good news is as you continue to age, it usually stabilizes because you're not really working and bringing in extra income. Advantage. There is a Medicare premium, that 144 is still collected. It goes to the managed care plans, but they don't usually charge you anything extra. They could an extra 10 or 20 or $30, but that's again in the details of each plan. They're run by private corporations. Most plans include the drug plan, but you still pay the $35, but you don't buy an extra insurance policy. They have extra benefits like some vision, some hearing, some dental. Again, you have to understand the details. And we don't have any more PPOs available in Coachella Valley or Riverside County for that matter. And around the country, there are a few PPO Advantage plans, but they're slowly going away. You will probably only see HMO network managed care, Medicare Advantage plans in the future. Open enrollment, they said October 15th through December 7th. What can you do? You can go from an Advantage plan back to original Medicare. You can go from original Medicare to an Advantage plan, or you can move around in those 48 different products that I told you that are available in Riverside County from October 15th through December 7th. That's why it gets so busy, because if people are willing or wanting to change, that's when they do it. If you miss that opportunity as a Medicare beneficiary, and you say you've chosen an Advantage plan that you don't like, you can go back to original Medicare one more time. So you actually have from October 15th through March 31st. This just changed 2 years ago, where they're giving the seniors an extra couple of months if they're not happy. It's kind of like buyer's remorse. If you want to change, you get one more chance. If you want to switch to another Advantage plan, you have one more time to do that. So those are the only two things you can do from January 1 to March 31. Special enrollment applies again to, if it's a 5-star plan you want to switch to, there's only one Kaiser, you can do that. Or if you move, that's called a trigger event, where you've moved throughout the year, you can change plans outside of the October 15th through March 31st timeframe. Annual enrollment, as I said, October 15th through December 7th. I think we're doing pretty good on time here. Prescription drug, I won't spend a whole lot of time on this slide because it can be overwhelming and confusing. There is a donut hole. I think Congress was supposed to vote on eliminating that donut hole. Of course, they tabled that. We'll see what happens in 2021. But it's good to know that it does exist. And when you do counseling with someone, you can drill down to your particular issues, what kind of drugs you take, how many, what kind of plan you have, what kind of plan you're interested in buying or switching to. And then if you take a lot of prescription medication, then you'll want to know more about the donut hole or coverage gap. It's just basically an area where if you take a lot of drugs, where you fall into that category during the middle of the year, and then you stop paying for your prescription drugs or copays. Low-income assistance, it's just out there. It's available as a service provided to you through HICAP. We also help people over the phone qualify for assistance. They get extra help in paying the Part B premium if they can't afford it at all. But you do have to have a low income to qualify. But the people on the phone at the HICAP offices at the 909 number certainly can help out with that. These are the different categories you have to fall into to qualify. You can't make anything over these amounts. They'll probably change a little bit for 2021, but they usually don't change that much. And here's what you get help on: a Part D premium or your deductible and copay, because if you don't have the income to qualify for an Advantage plan, or you don't have one that's available to you, or you don't get enough income to buy supplemental, you might get extra help here. The savings program is to help with the Part B premium, the 144 I talked about. That's a different low-income plan, but also the folks at HICAP can take your application and help you qualify for that, as long as you fall into these income brackets. Dual eligible is for anyone who's on Medi-Cal, goes through life on Medi-Cal. It could be on disability as well, and now they're 65. They qualify for Medicare, so we call that Medicare Medi-Cal, or Medi beneficiaries. The Medi-Cal takes up the position of a supplemental in the case of a Medi-Cal individual, and Medicare takes front seat. So you're Medi. You don't qualify based on your income to buy anything outside of that, but the state of California is heavily into managed care with Medi-Cal. That's what dual eligible means. So you would qualify to be either on one side of this chart or the other. And unless you are Medi, I won't spend a whole lot of time on it because it can be kind of confusing. And Cal Medi Connect tucks up under Medi. It's more of a managed care plan through the state of California with some restrictions, obviously. And dual eligible is the same part of the Medi. So there's three categories when you fall into the Medicare Medi-Cal category. Also under HICAP, we have another division called Senior Medicare Patrol, where we handle fraud and abuse. So if you feel like you've been duped by a provider for medical care, or someone offering you tests where they're asking you to pay for something and asking for your Medicare number, you can always report them. And they do work with the FBI, the Division of Medicare, the Senior Medicare Patrol under HICAP. We also come up under the Council for Aging. They also are part of the Medicare fraud and abuse side. The new card, that's been out for a while, but this slide just kind of reminds folks that we no longer have to worry about a Social Security number. It's a randomly chosen number, but you should protect it just as you do your credit cards, because it gets in the wrong hands. You know, they can build a Medicare program and cause you some grief. So that's what the new number looks like. Here is a slide from Medicare.gov. It's a very good website, but it can provide folks with a lot of information that can tend to overwhelm you if you're not familiar with what you need to look for. So all of these little tabs, when you click on them, they have drop-down boxes, and there could be 8 or 10 different subjects in there. Sometimes when I counsel folks, we'll look at it together and I help them navigate to where they need to be. If you're computer savvy and you like to read up on things, it's a great place to go. It's also where you need to go right now to sign up for Medicare. Now, this is anecdotal. I've talked to a few people in the last 3 or 4 months. Because the Social Security offices are closed, they're having to deal with calling an 800 number, and it's a very long wait. It can be 2 to 3 hours. And it's kind of sad that I have to say that, but that's where we're at right now. And the same thing with the Medicare 800 number. So as much information as you can gather in talking to someone from HICAP or someone you know that you can trust that knows this stuff, the better off you'll be in navigating on Medicare.gov, and only calling them if you absolutely have to with very specific questions. Now, I'm very hopeful that in a few months the offices will open. I would usually recommend folks to go down to Ramon Road. The Social Security office there is pretty organized and very professional. So you could talk to someone there. But until then, that's kind of what we're left with. Volunteers are always needed. It's a very rewarding thing for me, both when I did all my volunteer work and then as a part-time employee now back to volunteering, because I have found in 3 years that there's a tremendous need for information with respect to the Medicare program. 10,000 baby boomers turn 65 almost every day. So it's a very large population and a very lucrative population, which is why you have corporations entering the business of selling you Advantage plans, as well as supplemental plans. I tell folks when I counsel them, the corporations sell everything. They sell you a supplemental plan, they sell you a drug prescription plan, they'll sell you an Advantage plan. And they use different names for different products, but it gets confusing. For instance, AARP works very closely with United Healthcare. And people will say, well, I want an AARP plan, but that's not the insurance company. United Healthcare is. Does United Healthcare sell Advantage plans? Yes. In Riverside County, they have 5 different ones. Do they sell you supplemental plans? Yes. They might have 6 or 8 different ones. So that's where it gets confusing. And it's very important to talk to someone either through HICAP or that you know through an agent that you can trust that can help you with that. We talked about that. So here's some important information. The Rancho Cucamonga office oversees Riverside County and San Bernardino. So the 909 number is the office where I got my training from up in on Haven Avenue. Prior to COVID, I would go there monthly. I would get my credits in. I would get, they'd hold a meeting once a month where they bring in guest speakers and we learn all about Medi-Cal and other things, but we don't have that right now. So what they're doing is they beefed up the telephone appointment schedule. If you call a 909 number, you'll go into a queue. You may not get a human answering, but they'll say, leave a message and we'll call you back. And they're triaging the calls based on the number of employees and volunteers that are still with them right now. So it's not the best, but it's what we have right now, because in the times when I was first volunteering, I was meeting at 3 different senior centers, probably 2 or 3 times a month, spending 4 or 5 hours a week talking to people. So I'm very hopeful that maybe next year, when all this is behind us, God willing, that we get back to that. So I gave you the 909 number here. Social Security, there's the number, and then the SSA.gov website. There's the Medicare 800 number and the Medicare website. And if you're a retired military person, the VA, I don't know if the VA here in Indio is seeing you. It's probably limited or probably over the phone, so you'd have to contact them directly. So these are some important phone numbers that you should write down. If you don't get a chance to do that, you can always call Kathy, and she's a wealth of knowledge. Worked with her about 2 years, and she can give you whatever information you might need to contact HICAP directly. And you can go to Facebook, and there's the website or the Facebook connection, www.facebook.com/IEHICAP. And HICAP just stands for Health Insurance Counseling Advocacy Program. It comes up under SHIP. Every state I believe every state in the country has a SHIP, State Health Insurance Program entity, and they're funded by partially from funds from CMS, which oversees the Medicare program, which are federal dollars as well as state dollars. So it's all nonprofit, which is why we do this as a volunteer. And the few employees that we do have, there's never a cost to the client or the beneficiary. And I think we're done. It's 10:30. So I'm pretty good on time here. I'm hopeful there's some questions, and I'm leaving that up to Brett.
Yeah, so there isn't any, oh, hold on, there's one in the chat. Let me see. What does the acronym SHIP stand for again?
SHIP is State Health Insurance Program, SHIP. As I said, they're in almost every state. and HICAP through the Council for Aging rolls up under SHIP.
Great, thank you.
Okay.
So that was the only question in a chat, but Matthew, can't hear him. Oh. Matthew, can you hear me now? If it would be stupid if I would actually move my microphone down to my mouth. This new headset, it's like, my apologies. So SHIP, I think you heard Connie say it, but the SHIP was the, what does it stand for? So it's
Health Insurance Program.
Great. No worries. And Jack Newby wanted to say he's off to another meeting, but wanted to say thank you to everybody. But you can unmute yourself. If you have a question that you think would be pertinent for the group, please unmute yourself and feel free to ask the question. If you have more of a private, personal, unique situation, please hold that question, and then we'll reach out and give Kathy's phone number, and Kathy, I think, is still in the room. So I want to make sure she gives the right phone number, and you would call her, and she will then set you up with a one-on-one appointment with Connie. This is Kathy. Kathy, what's your phone number you want to use?
760-610-7205.
Can you repeat that, please?
760-610-7205.
Great, thank you. And we do have another question as soon as this pops up. Come on. See here.
If Brett wants to type that phone number in the chat so people can see it.
This phone number?
Brett, do you want to write my phone number in the chat so people
Sure.
can see it? Maybe they can look at their chat thing just so they see it written. I know with the mask it's hard, but Connie and I are in close proximity. So
Yeah, I can.
Okay.
You want me to repeat it?
Yeah, so 760-610-7205. Okay, Kathy. All right, I just put it in the chat as well. And we have a couple of more questions.
Okay.
Let's see here, one more. Who do I call to volunteer as a AHIP licensee in the Coachella Valley?
Okay, so someone's interested in becoming a volunteer for HICAP.
Yep.
I would strongly recommend that they call the 909-256-8369 number and ask for Tamika Perry. She is who I work with now. All the volunteers in Riverside County come under Tamika. She also organizes the training program, one that I took back in 2017. Of course, it's probably virtual now through Zoom, but in the past it was done where you went to the classrooms in a classroom setting. But they're always innovating different ways to do it, and it's a great training program. So Tamika Perry, and that's the phone number, 909-256-8369.
And I also have that phone number, so if you need it, you can call me and I'll be happy to share that with you if you didn't catch that just now.
There's also an 800 number for folks who are concerned about the cost. So it's a toll-free number. It's 800-434-0222.
Great, thank you. I have 2 more questions. Let's jump to Brian, though. Brian, you had your hand up if you want to unmute and have a question.
Yes, thank you. Could you please repeat the part about if you transfer from a Medicare Advantage plan back to original Medicare, it showed that you could only do that one time. Is that one time in your life or just for that year?
Okay, so what generally happens is if you're brand new to Medicare, you just turned 65, or you've never really been on Part B because you've been employed. So you're kind of new to Part B. There's that honeymoon period, I call it, where you, if you choose an Advantage plan that first year and you want to switch back during the open enrollment period, which is that October to the December 7th or January through March of the following year, the supplemental plans cannot subject you to underwriting questions, which is that special period of time that I say. So it's guaranteed issue. When you hear the words guaranteed issue, it means there's a certain time frame that you're guaranteed to be issued a policy by the supplemental plans. However, if you're fairly new again and you switch right over to Advantage and you're not really opting out of Medicare A and B, you never do. That's always yours until you're no longer around. You're just trading it in for an Advantage plan for a year or however long you stay on it. But if you're on it for a few years and you develop some problems or you have buyer's remorse, you don't like it, and you now want to move over to buying a supplemental plan, you might run into some problems with having guarantee issue by the supplemental plans, issuing you a policy or subjecting you to underwriting questions. It's generally a piece of information that's not disclosed openly, even on Medicare.gov. It's disappointing to me. It's a general thing that I have learned over the course of time from talking to people as well as researching it on my own. But it's very real. That's why when I counsel, I let people know as often as I can, if you're with Advantage and you've been with Advantage for 5 years and you're relatively healthy, you might be okay moving back over to a supplemental plan. But if you develop health issues, you're going to probably run into problems. So with your particular issue, if you haven't been on Advantage for very long, open enrollment would be your chance to go back to original Medicare. But you could always ask for some personal advice as well through contacting Kathy.
Great. We have a kind of I think, an associated question. It says, I hear it's best to start with a supplement plan first over the Advantage plan, and why?
And that's wise. And the answer, first of all, the answer is yes. Because when people enroll in Medicare, generally speaking, even some folks who've gone beyond 65, we're relatively healthy, for the most part, active senior population. So many people don't think about the days as they age, what's happening to them. So they don't want to spend any extra money and they go right to Advantage. But for the few extra dollars, you start with a supplemental. If you feel that an Advantage plan can replace what you've had with the original side and you're okay with it, you're not going to run into underwriting problems or questions. But if you stay with original Medicare, it's likely that you'll be okay. It's when you want to go from the other side back over to original Medicare. That little chart, I don't know if I can go back to it. Oops, let me see if I can, let me go back to that. Here, can they see that little chart there? I made it small again.
Kathy, you just need to share it,
Yeah.
or as a presentation.
Oh, sorry, I'm not sure which page that was.
There we go. So if you look at the chart again, the visual is so helpful. You're correct. If you stay to me, it's the left of the chart, A, B, D, and supplemental, you're pretty good. And there are some really good plans out there that we could counsel you on that keeps you in the original mode. But when you go on the Advantage side and you're there for a few years, you might have some difficulty having an Anthem Blue Cross or Blue Shield sell you a policy without asking you the underwriting questions, which they're entitled to do. So this is what happens when the corporations cut a deal with the government to sell these plans, because that's kind of what they're doing. There are rules that they have to follow, but they also ask for concessions. So those concessions are, the government will say, you cannot ask any of our beneficiaries health questions. They agree to that in the open enrollment period during when you're brand new, when you first enroll. That's the guaranteed issue period. But then the insurance companies come back and say, but if a few years go by and they want to come back over, we want to have the right to ask them those questions, and that's what they're given. So I hope that answers your question without it being too long-winded, but it's always best to stay with original Medicare. That's my opinion.
Yeah, and I think the secondary question to that is can you start with a supplemental, switch to Advantage, then switch back in later years? And I think you said, yes, you can. You just have to really look closely at your situation.
Look at closely at your own health situation. Yeah. If you're still relatively healthy and you are okay with the medical questionnaire that you're going to be asked to fill out, go for it. And they might charge you a bit more because insurance companies can, but it's a slippery slope and many people don't know that piece of information. So I like to share it with them.
Great. Another question from Robert is, are there any Medicare plans that are HSA, health savings accounts?
Now, on the supplemental side, HSA doesn't really exist on the Advantage side of my chart there. So if you're A and B in Part D, your original Medicare, there are several plans. I just reviewed this for someone on the Blue Shield website, where there are some plans, and I don't want to get into the weeds here because they're labeled by the alphabet, that offer you HSA. It would be a good idea to have a counseling session with someone, unless you can really go on the internet. And there are people who are computer savvy that can figure out where the HSA savings plan measures up from a monthly premium standpoint versus a non-HSA plan.
Great, thank you. Another question, which not so much a question, it was more to me. Yes, this presentation will be available, not necessarily on YouTube. It will be available via the Joslin Senior Center's website. And I'm not sure, Jack's now off the line, but I'm not sure if they have a YouTube, but it'll be posted on their site within probably 5 to 7 days. We edit it a little bit, tighten it up, and then we get it over to them, which I'll do later today, and then it'll probably be up within next week. And so this in its entirety will be back on their site. As an Eisenhower piece, we don't necessarily put it up on YouTube because we're doing these frequently, but it will be on the Joslin site. And I think that's all the questions I have in the chat. Unless anybody else wants to write one. But if not, you can also feel free to unmute yourself and ask a question, or raise your hand and ask a question either way. Okay. We have many thoughts here that say it was very thorough. Ms. Shelby is awesome.
Thank you.
Thank you, thank you. So your first foray into Zoom Medicare lesson was a success.
Thank you, Brett. You are a wonderful instructor. And I think Kathy, who's held my hand the whole time.
Yeah, so with that, I don't see any other questions unless there's somebody who wants to quickly ask. But if not, you do have the number for Kathy. As I said, it was 760-610-7205. And you would talk to Kathy Lewis with Eisenhower, and then she will connect you with Connie for a one-on-one informative session that you would do via Zoom as well. Or I think that's the plan at the moment. So I guess with that in mind, I don't see anything else. And so thank you to everybody for Zooming in, and thank you, Connie, for taking your time out and coming into the office to make this happen.
You're all very welcome. Thank you, Brett, and everyone have a good day. Thank you. Stay well.
Thank you.
Bye now.